to contain the outbreak. And here with me now to continue the conversation is Dr. Lakshman Swamy. He is a critical care physician and creator of Critical Care, The Game. Welcome to BNC Live.
Thanks for having me.
Dr. Swamy, we are seeing a surge in new COVID cases across the country. We're also seeing a rise in hospitalizations. Are we seeing a rise in deaths as well?
I think what is hard to disentangle here is that what I'm seeing in the ICU is certainly a surge in cases in ICU patients and deaths. Now, whether that's all due to Omicron or not, I don't know, but this was happening since early December. It's kind of like the winter surge started then, just as we were hearing about Omicron. So I think what we're experiencing in the hospitals is very full hospitals and a lot of people getting very sick and indeed and dying. But how much of that is related to Omicron, I don't think I totally know.
Wow. We're learning more about this variant. We know it's more transmissible, but we're seeing its impact particularly hitting children really hard. So what's the most important message you think parents need to know about this?
Yeah, I think the most important message is that, first of all, most kids are going to be fine, even if they get infected with Omicron, especially if they've been vaccinated. And I think that needs to be said over and over again is that my two kids who are of age to get vaccinated both have had both their shots. And I think that gives me a lot of relief knowing that I'm still going to do a lot to protect them, like masking and all of that stuff. But the vaccine goes a really long way in making this very mild for most kids, but not every kid.
And, we know hospitals were already overwhelmed before this surge. How are you and other people handling this influx of cases? Because this is, gosh, we're in year 3 now.
We're in year, oh my God, and we're so much more short-staffed than we ever have been before. The decisions we're making about beds every day, it's not where we want to be. It's not where anyone wants to be. It doesn't even matter just about COVID. Anyone who's coming to the hospital sick, we're seeing everything, right? It's far from ideal. We need more staff. We need more vaccines.
Talk to me a little bit about those decisions. You say the decisions that you're having to make every day about beds. What kind of situation are you in, and what kind of decisions are you having to make for people?
And I think that, first of all, I can say that from talking to my colleagues across the country, I think this is true pretty much everywhere.
Right.
We just don't have enough staff. This isn't unique to my hospital. This is very common. And the way these decisions play out is sometimes very subtle, right? And what it means is that someone, in the intensive care unit, we should always have the sickest people in the hospital, and we always will, we always do. But when we don't have enough nurses, that means that that's one less bed that's filled with that person, who then the least sick person in the ICU who's very sick is going to not be in the ICU because we just don't have someone to take care of them. Those are the kinds of cascading decisions that are happening every day. Even decision isn't even the right word. It's just what we have to deal with. And it affects everyone. It affects everyone coming into the hospital for anything. And it affects people who need treatment for cancer, they need surgeries, all of that stuff is being affected.
And so just explain a little more sort of the domino effect when you have to make decisions like that on shifting really sick people to maybe floors or to treatment facilities that they wouldn't normally go to if the pandemic wasn't something that we were in the midst of.
Last spring, in many hospitals, we invoked the sort of crisis standards of care. And that is a horrible thing. And what that meant was that we were saying we accept that we cannot deliver the normal, very high standard of care to every individual patient. That was a terrible time. And we have come close to it many, many times. And what we're in now is almost like a slow burn of constantly being just above crisis standards. And what that means is that a lot of times people are across the country not getting the absolute best care we could give them, not for lack of trying by any means, but for the lack of ability to do it. And that has kind of a cascading downward spiral effect where it leads to more people getting more sick out in the community. Hospitals are already so full, and everyone has to take care of people that are sicker than they should be taken care of to some degree. And that falls all the way down to people in their homes who are taking care of people who really should be in a hospital, but there's just no space.
The FDA announced approval of the Pfizer booster shot for children as young as 12. What should parents know?
I think that first of all, this is not surprising. We know that with kids are not so different. We know that getting boosted matters a huge deal right now for Omicron and for hospitalizations now and everything. So it's not surprising. I'm glad to see that the decision was made pretty quickly, for 5 months too. I don't think people should panic. Again, there's a reason that window is there. This is boosting the response you got from the original 2 shots if you had an mRNA vaccine. So I don't think anyone should be panicking, but this is kind of the new reality is that we need to keep getting shots. No one wants it. And it's hard to do. It's hard to make it happen for everyone. But that's the reality now is that people need to keep getting immunized until we have control over this. We won't have control over this till we really get everyone immunized.
And doctor, do you think now that kids can get vaccinated and boosted and now the younger groups that we're going to finally see the curve in this?
I really hope so. It's a huge population that we hadn't been able to touch until recently. Like I said, 2 of my kids who are old enough have already been vaccinated with the full series. So I'm hoping this is a big shift. But at the same time, every time we think we've gained some ground and clarified things here, now Omicron pops up and is changing the rules on us. Where, yeah, I mean, it's really, really fantastic that people aren't that sick. But my kids aren't in school today. There's so many staff out with positives, and it's not a simple thing to just say let people come back in. I think the priority is to get kids back in school, absolutely, and I think we've proven that it's very possible to do that safely. But it's going to take more than just vaccines. Unfortunately, we need that vaccine foundation, and then we need better masks. We need improved ventilation in the schools. We need all of that stuff to come together,
Yeah, I don't
and
think.
tests.
Yes, as a parent, I don't think any of us want to go back to the days of extended virtual learning or
Oh,
we're becoming teachers as well. It was rough, right?
that was rough. That was rough.
Well, thank you, doctor, for joining us here on BNC and for all that you do. U.S. Secretary of Defense Lloyd Austin has tested positive for COVID-19. According to a statement released by the Defense Department, he is experiencing mild symptoms.